It's not quite fall just yet, but health officials are already bracing for three major viruses that may all start spreading at the same time in the U.S. However, this year there's a new weapon in the fight against these respiratory illnesses. Mandy Gaither has details on what health experts say you should do and what you need to know before cold and flu season.
Excuse me.
It's another potential triple threat of viruses: the flu, COVID-19, and RSV. All three may hit the U.S. together this fall, but this year there's a vaccine for all of them. When to get them varies based on age.
If you're under the age of 60, before Halloween, you should get your flu shot. Late September for COVID, that's when that new booster is expected to come out. It is not an exact match for what is currently circulating, dominantly circulating in the country, but it's still good protection, especially for people who are vulnerable.
The U.S. is already seeing an uptick in COVID-19 cases, although it's still unclear exactly how many cases, as fewer tests are being taken. There are patches of the country in red, with a more significant increase in hospitalizations, a few states with numbers going down, and others staying stable. Still, COVID-19 hospital admissions are lower than in years past.
The numbers are going up, but August of this year, right now, is about a quarter of what August of last year was.
The U.S. Centers for Disease Control and Prevention say if you test positive for COVID-19, isolate for 5 days. On day 6, isolation can end if symptoms improve. The agency does recommend masking until there are 2 negative tests taken 48 hours apart.
It's a little complicated, but really the first 5 days, that's when you're most infectious. That's when you should stay home.
For Health Minute, I'm Mandy Gaither.